Okay, members and friends, we're up by a little homeless camp here, up in the middle of Surrey. This is the tree where Janice Shore was hung from. I already did a video on that. So I'm going to go in here and see if anyone wants to do an interview with me about the subject of Ebola and the Canada healthcare system. Hold on. Okay, members and friends, I'm back home now. It's not a fashion show, right? Although, as a Marax, it's important that you get back up on the horse. You seen that dude? After you listen to this little statement that I've got to say, you're going to see a video where I just came from. Because I just came back from a camp that is kind of going in the direction of a little protest. Well, I wouldn't say little. It's going in the direction of a protest because people are tired of being flushed out into bushes. So they said enough is enough, we're staying put. Anyway, so in that little clip there, the dude I was talking to initially decided that what I had to say he thought wasn't that important because to him, you know, being free and living off, you know, wherever you plant yourself in terms of, you know, he didn't consider himself homeless. He considered himself free. And I eventually just told him after 12 years of living like this for yourself, maybe it's just kind of like desensitized you to the more serious matter at hand in terms of, you know, what homeless, how it affects people in that situation and how it affects the community as well, right? Including individuals that actually have to face day after day after day, you know, having to live homeless. And so, anyway, what we were talking about was, you know, what if Ebola was to come to Canada in Surrey, British Columbia, Canada, right, in Surrey. And, you know, are they, first of all, even aware of such a thing, such a virus? And the one lady I was talking to after the camera went off, I probably should have left the camera on and maybe just put it down because she wasn't feeling comfortable go in front of the camera. Her name is Tina, right? Anyway, she was telling me that she had absolutely zero clue about the issue around Ebola and how it's spreading in on the African continent, you know, within those few countries, and how it's slowly but surely, you know, permeating itself into the Western world, whether it's, you know, people being brought back on plane by themselves through their charities in terms of if you're a, you know, a volunteer like a missionary or something. I think it was some missionary organization that flew back, you know, their missionaries that contracted the Ebola virus, you know, via nobody really knows yet, right? Or if it's a person coming in off a plane, you know, and then going to the hospital and then being told to go home with some antibiotics, and then 2 days later he's being transported back to the hospital in an ambulance, right? And then a week later he's dead from Ebola, right? Well, you're not even a week after that, you've got 2 nurses now coming down with Ebola, have been tested positive, and this is up in the Texas area. Well, up in Pennsylvania, you know, you've got the SWAT team swarming airplanes because somebody happens to be sick and thrown up on the airplane there. And, you know, as usual, you know, Canada is coming up slowly in the ranks, and I guess the federal government just passed some bill where, you know, 6 airports out of all the airports all across Canada will now start introduce screening in terms of checking temperature. Because that's what they're doing. They're checking temperature. They're not following up on each and every passenger that's flying in to, you know, find out who they're in contact with day after day over a period of 21 days, because the incubation period for the Ebola virus is up to 2 to 21 days. So as long as you're not showing a temperature, you know, whether you mask it with Tylenol or not, as long as you're not showing a temperature, you get a free pass into the country, whether it's the United States of America or whether it's Canada. Canada is not as aggressive as the United States is, and my feel on that one is, well, there's 320 million people in the United States versus 36 million in Canada, but that's not to say that Canada itself is not at risk, which we are, because we get people coming in from everywhere on these airplanes. And anyway, Tina had absolutely no clue that any of this was going on, because she's too busy in survival mode. She's kind of like in my situation where, you know, her kids are abandoning her, and, you know, and she's having troubles with this and troubles with that, to the point where she's just financially knocked right off the freaking wall, right? And she loses her house. So she's been out in that camp for about a month, right? And, you know, the other fella, when you watch the clip, the one that was holding the camera was saying, well, yeah, I take responsibility for myself, and yes, I should try a little harder, but I also, you know, touched base with him, and, you know, and came to the, you know, to the concept, well, I wouldn't even call, you know, the realization, you know, to help him realize that, yes, you know, it's all fine and dandy what you're saying, but at the end of the day, I know what happens. If you're out here for too long, you get caught up in a rut, and then what happens? You know, as much as, no matter how motivated you are, if there's not the right, you know, I don't want to call them programs, but support, if there's not the right type of support structure, right, to help you to break away from that, where you're at, even though you know, you think you've got the ability, or you have it, and you got the initiative, and you got the drive, and, you know, you've got the motivation, and you've got the intelligence, and you've got the will, and, you know, you've got the health, right? And you still got, you know, your wits about you, but you just don't have that support system to help you to get out of that rut that, once you're out there homeless, people, that's it. It's very, very hard to break away from that rut. And then you end up like that other fella that took my hat and threw it and told me to get the hell out of there, because, you know, he wanted to go on about his la la land of being free, you know, living off the land, and everybody should be homeless. Well, you've just been out in the streets for too long, buddy. 12 years is just too fucking long. I mean, that's what it's reduced you down to be comfortable with what you've got, because you've already accepted the pain around it. And I told him that. He didn't like that, so he flicked my hat and told me to go somewhere else. So I talked to Tina. I went and talked to Tina. And Tina has absolutely no clue that there's the potential of a deadly virus showing up in our local neighborhood. And she agreed that, you know, it only takes one sick person in her community to put a whole lot of already vulnerable people at risk. 10 times more than, say, someone like me. Because I said to her, I said, well, what happens if we get it? How do you think the BC Liberal government is going to handle that problem? Well, we don't have a military like the United States. We don't have functioning hospitals. And I know how our local hospitals treat the most disenfranchised, mentally ill, drug addicted, homeless, even with their wits or with no wits. It doesn't matter. As soon as you, even me, and I'm not homeless, I know how I get treated within the healthcare system. You know, if they start showing up with Ebola, first of all, people are only going to stick around for a little while. And then once it gets out of control, it's going to be survival of the fittest, sink or swim. And, you know, the healthcare workers are going to abandon ship. People will be in the hospitals looking after themselves like they have in Africa, because they're only going to tolerate it for so long. They're going to want to go home and look after their own families. And the only thing that I could think of that a government could possibly do to stop the spread in my area, right? I put myself, well, if I was the premier of the province, what would I do? I'm just the mayor, X, which really has no constituency other than a YouTube channel that's connected to a non-profit. But if I was the premier of this province, you know, and I had the potential of a major disaster on my hands due to a pandemic because of a virus, and I don't have the assistance of the military, right, like the United States does, because we just don't have that kind of infrastructure, and it's being dispersed all across Canada, because if BC's at risk, you know the rest of Canada is at risk, just like the United States is at risk, as these airplanes are flying in, because that's where it's coming from right now. That's how it's being imported, is through the airplanes, and, you know, immigration, that type of thing, or holidays, or whatever. You know, what would I do to protect the public? Whether they're, you know, middle class, low income, or homeless people, what would be my first protocol? And first thing that comes to my mind would be curfew. I'd quarantine people into their houses. I'd curfew them into their houses. But that's a big drastic call, because once you start curfewing and telling people not to leave their homes to stop the spread of a virus, then your whole economical infrastructure starts to fall apart. But it's going to fall apart if people get sick. And with this I can't pronounce it right, hemorrhagic fever, where, you know, you're just infecting everything and anything around you. I mean, there's only so many people go around cleaning up for so much before they want to go home and look after their own family, right? And that's what's happening in Africa right now. It's beyond cleaning up. That's why some prime ministers out in that part of the world are putting curfews, 3-day curfews, where nobody can leave their homes. And this is what I was saying to Tina, at least if with me, if something like that happens to me, regardless of what my kids are doing on me, because again, they don't think about this stuff, right? I will survive. Whoever is in, and I invited Tina to come to my house and help me cook, because we'll cook for others as well, because I got a little extra to share with other people in the neighborhood. The only thing I didn't do was buy myself a dog and a gun, yet, to protect the food. Because if the shit hits the fan, you know, I don't want a bunch of crazies coming to my door, banging on the door saying, give me some food. I'd be like, no, go work for it. I need a pond dug out there. Even though, you know, the world is falling apart, I still want my pond. And if you can't work for your food, then you don't get no food. But I know Tina will come and help me cook some food. And, we'll survive, because I'm not going to leave her out there. And I said to her, if for some reason, I told her I'm going to come back and talk about this too, and I gave her a web channel, right? I said, if for some reason the shit hits the fan because you didn't know, nobody even came and told you about it on a pamphlet. Nobody, and we know what, if you go to your local hospital, what's going to happen if you show up with sickness of Ebola. Never mind just coming in sick with your $80 ambulance bill. Because as soon as you call an ambulance and you get in the ambulance, no matter who you are, with zero income, the BC Federal Revenues is going to come after you for their $80 ride. So they're criminalizing the poor right from the get-go. So before you even get to the hospital, you're being mistreated if you're poor. Because you don't have $80 to pay for the ambulance bill, which is supposed to be a public service. So and these people that work in this industry, they know the poor people aren't paying, right? So they're pissed off at us. So we get mistreated. You know, we get down-talked to and, you know, poked too many times and left on the floor, which I know for a fact because I picked up my own drug-addicted daughter when she was a teenager off of the floor in the hospital because that's where they left her. You will hear on the video that the people are still being treated like that if they're on the cusp of being homeless or are homeless. Not factoring in all their other issues that they have to deal with and why those issues manifest themselves. So I said to her, you see this tarp? If it turns out the cops show up, never mind trying to throw you out. But if they come in and they put a freaking thing around and say, that's it, you're quarantined because there's an Ebola breakout. See this tarp? I said, make yourself a hazmat suit. That's what you do. Go buy some bleach. Store it right now. Go buy some baking soda and some gray tape for yourself. Because it's going to be survival of the fittest. Really. That's what it's going to come down to if it gets out of control. And right now, you know, because it's so minute in numbers, and you're only getting spin on it from many, many, many different directions, right? Because I've read on the internet already that someplace in Ontario, they've got someplace on lockdown, but nobody's allowed to talk about it. So he's trying to get the message out through his little comment section. I have seen videos where people in U.S. Minister, British Columbia, Canada, are emailing to the United States saying that we just came in from Africa and one of my so-and-so is showing symptoms of quite possibly Ebola, but they're afraid to go to the hospital because there's no protocols. And they don't want to be stigmatized with coming in with the first ground zero case. That's just examples. So it could be here in Canada on the West Coast, but nobody's preparing for it. And if they are, I know if I was homeless and I knew that there's somebody who was going to lock me up in this little camp because all of a sudden, you know, Harry over there came down with flu symptoms that could quite possibly be an Ebola. And if Harry's a heroin addict that's injecting, well, that's just going to put more people at risk that aren't injecting drugs, you know, that are homeless. Because not everybody that's homeless is injecting drugs. But we don't have a safe injection site out here. So there's nothing out here to stop the spread of body fluids. And it's my personal opinion that, and this is where I'm going to go with it, when it comes to people with injecting drugs, is if it's in your blood, And you're not contagious until the blood starts to seep out of your body. In other words, you get the disease or the virus or whatever. For 2 to 21 days, it goes in an incubation period until you start bleeding out. But it's the minute that you start bleeding out from every orifice of your body, including puking and shitting, that the virus lives in. But it's been incubating in your blood. And once that blood comes to the surface, you're contagious. Well, if somebody's injecting drugs and maybe not showing symptoms, but they have the virus and they're injecting the drug and the blood spews out, because that's what happens with addicts. You know, it's just the blood goes everywhere. That's why you want a safe injection site, so that it's isolated. It can be disinfected in between each individual that's injecting drugs to prevent the spread of disease, right? It's just going to take one. And the thing about addicts is they can be sicker than a dog and still not go to the hospital, because they're so used to feeling sick that to them it's normal. So before they get to the hospital, half of them are already half dead. That's how extreme it has to go before they get there. Never mind that they're afraid to call the ambulance because they can't afford to be criminalized anymore for another $80 because they're sick. So I basically told her she needs to protect herself now that she knows. Just like the rest of us have to try and educate ourselves and educate those around us, because this isn't a joke. Because the Canadian government on the West Coast is not prepared for this at all. They're not even prepared to handle with what they've got. They flush out poor people out in the streets with all kinds of sickness, and they don't even try to accommodate them. And then when they come together for protection and they congregate and they try to stand up for their rights, you get the local cops coming in and you got them tearing down their signs. This is what Tina was telling me. 2 weeks ago they were trying to do a little protest. I said, next time you do a protest, call me. I'll put it up on my YouTube channel and with the rest of my channel, videos on my channel. Because how many years do we have to keep doing this? And, you know, quarantine people and all this other stuff, you know, it's only going to last for so long. Because our hospitals are already overwhelmed. Assuming that you even want to go there, depending on who you are. If you have a good pension plan, chances are you're going to get treated good. Already done videos on that one. If you're the poorest of the poor, whether you have a home or not, whether you have addictions, mental health issues or not, it doesn't matter, you're poor. You're going to get second-class health care. And that's just the way it is. Even me with my eyes. Even me with my teeth. And if you notice, I brought out Christy Clark's AAA credit rating board. I have to just start filling in some blanks. And go find another board to add on to this board. It's going to take me a little while, people, because I'm really busy. And my brain is scattered and I've got lots of things I have to do. But this is important. This is the history of the nonprofit. Okay? This is why I do what I do. Just to keep putting out the good spin. That if we come together, we work together, we'll survive. Because she said, well, how are we going to survive if this hits? I said, well, make your own hazmat suits for one thing. And if somebody starts throwing up all over the place and all that stuff, don't be too quick to go help. You know, call a professional. But how long do you think these professionals are going to want to pick up sick people off the streets, knowing that it's not just drugs anymore, it's Ebola? And then go home to their own families. When we've got American nurses sitting up in Texas coming down with Ebola, with full-fledged hazmat suits that have been nurses in a professional environment for umpteen years, and they can't even protect themselves. And that's what we know about people. That's what we know about. So keep educating yourself. So I'm going to now put this with first, and then I'll upload, put them together. It'll be a long-ass video, but whatever. We'll just deal with it one day at a time.